Good evening, everybody. Back here with another video for you all. And today we are going to be talking about some bacteria. So this video covers let me make sure I say this right, the gram-negative cocci bacteria, Neisseria and Moraxella, and then the enteric gram-negative rods. So two lectures today, and we'll jump right into it. And so these cards are going to be helpful. They contain some sketchy images, and Sketchy is really helpful from what I've heard for learning microbiology and specifically the bacteriology. So similar to viruses, if you watch my videos from back in FOM4 these cards are kind of helpful. And like the viruses, they contain a question stem, but then in the description, like the helpful hints below, and if you click first aid, there'll be a first aid section. There might be a sketchy picture. There's usually a sketchy picture with these ones. So that's helpful. And then you can link that with sketchy pictures and videos in the textbook if you have any of that. But we'll get started. So first aid, microbiology, and then we're being clinical bacteriology today. And we're going to jump down past all the gram positives and come down to the gram negatives. And we're going to go out of order from what we learned it in. And I just want to preface with the fact that I could not find cards on Enterobacter cloacae. If those are in here, please let me know if I missed them, but I couldn't find any, and it's just one slide in the PowerPoint, so maybe it wasn't high for first aid onking, but we'll get started. So we're going to be in Neisseria 24 first, and like I said, under clinical bacteriology. So we'll start in basics, and then make sure your cards are organized the same as mine with the sort field arrow pointing down. You want to activate all the cards here, and then you can come down and deactivate the second, third, and fifth coming up from the bottom. So specifically talking about the membrane attack complex and the complement factors being deficient. That's just the hyper-specific that I didn't think we needed for our lecture, but it might be good for boards. And then in Neisseria gonorrhea, you want the first two, but then you want to skip 3 and 4. And then you want to grab this rest here. And then with this one, you want to skip the Fitzhugh-Curtis syndrome cards here in the middle. And then you want to grab the next 4 after that. And then this one here, which bacteria present with white blood cells in urine, but no bacteria in the sterile urine. It's just kind of like comparing two things, and I didn't think this was a key thing. But this is good to know. Treating meningitis or gonorrhea with ceftriaxone. Again, didn't want these two here, which two bacteria cause them are the most common causes of pelvic inflammatory disease. Just know that Neisseria gonorrhea causes pelvic inflammatory disease. And then what kind of discharge is seen with gonorrhea? The creamy white purulent discharge. And then you can skip over a bunch, and the last one down here is Neisseria gonorrhea does not have a polysaccharide capsule. And then we'll go to meningitis. And you want to grab the first 5 here, skipping 3, and then grab this last one. What is meningococcemia, or what is the etiology? And then you can come down, and if you're looking at the cards, so you see the patient's card, you don't want that one, but the next one and the rest are all good to have. And so that is it for section 24 in Neisseria. And then we're going to move down to 31, the Salmonella versus Shigella. And in Salmonella, you can activate all the cards here, and then you come back and deactivate the 4th card, just because. So I activated some of the treatments, but that's if they were like key, like kind of easy. So like ceftriaxone that's just a quick injection. You just give quick, and it's a pretty common one for at least STIs. But then there are some, and that was what was said in the lectures versus sometimes in the lectures it said like you use this, you can use this, you can use this, but recommend resistant testing. So if that was the case, I just didn't activate those cards. But that's why I did it before. And then so this one, yeah, you don't want card 4 because the fluoroquinolones was just like one option of many. Coming down to the bottom, you don't want the last one, and then working your way up. Humans are the only reservoir for Salmonella typhi. This wasn't explicitly stated, so I don't have it activated. And then this one here, that type 3 secretion system, I don't know what that is, so didn't have that. And then in Shigella, you want to skip the first 3, and you want to come down and grab these 3 here. talking about invading M cells and Peyer's patches, and then the hectone auger. Then you can skip this one, talking about schistocytes. But grab this one, that it's a mucosal invasion, and then skip the next one. And then grab this one, that the required effective dose for Shigella is small. And then you can skip this one. I skipped a lot of the hemolytic uremic syndrome cells, or not cells, cards, because it was mentioned as a part of the disease presentation, but we didn't go into depth on hemolytic uremic syndrome. And then after that card, you want to grab the next 6 here. So going over dysentery and then like a little bit of characteristics. You can skip this one again, an effector protein type 3. And then you can grab the next 5, talking about characteristics of like colonies, the watery or bloody diarrhea, the inflammatory diarrhea. You can skip these 2 here, talking about the 60th subunit of the ribosome. That wasn't explicitly stated. Shigella is not motile. That's a good one to have. Again, skip the HUS card. And then from the bottom, you just don't want the last one, but you want the 4 leading up to it, talking about characteristics. And that is it for Shigella and Salmonella. So we're going to minimize that, and then we're going to go down to E. coli. Lots of cards here, so we'll take it slow, and just keep track of which card I have highlighted when we move. So you want the first 3, but you want to skip 4 and 5. And then you want to come down here and grab the labile, and the enterotoxigenic cards. Here are these 4, but you want to skip the enteropathogenics, because we didn't review that. And then you want to come down and grab the enterohemorrhagic cards here. And then you want to skip over sterile pyuria and then the enteropathogenics and aggregatives. So we didn't go over those. And then after the last enteroaggregative, you can highlight which gram-negative enteric bacteria is catalase positive. It's E. coli. And leaving that where it's highlighted, we can scroll all the way down. And you want to grab those next 3 following that card. So 4 in a row. Then you want to skip one because we didn't talk about sorbitol. Grab this one, not this one. Grab these next 2 here. What is the treatment for E. coli? Again, this was like not hard set, so I'm going to wait for the lecture to come from that. I think Dr. Vichy or Fuchs gives us that. And then there's this card here talking about what is the common cause of gram-negative sepsis. It's E. coli. And then meningitis is E. coli meningitis. And then you want to not have this one because we didn't talk about uropathogenic E. coli. And then after that, you can activate the rest of them. And then the ones you don't want, so the Fimbriae, Shigella toxin, and then all the antigens you want, and then the last 4 you want. But these ones in the middle, the enteroinvasive, we didn't go over. Septic abortion, not big, not big, not big. So those might be good for boards, but for our lecture content, we didn't need them. That is it for E. coli. And then we're going to move to Klebsiella and Klebsiella plain. Simply, we're not going to do Klebsiella granulomatous or mattis. And so you want the first 2, and then you're going to skip over these ones. These ones are all the Klebsiella granulomatous, and then a few other ones about really specific on the pneumonia, but we don't need to know those. So you can skip, I don't know, what is that? 7 cards? Yeah, 1, 2, 3, 4, 5, 6, 7, 8. Skip 7 cards. Come down, oxygen dependency of Klebsiella is facultative anaerobe. After that, you can activate all of them, and then the ones you don't want is this Klebsiella granulomatous. It's most prevalent in, it says Africa, and I think the only slide that showed like that belt in Africa, and it wasn't Klebsiella. I could be wrong. If I'm wrong, let me know in the comments, please. And then the other one is Klebsiella is also pyogenic liver and organ failure and abscesses. That wasn't clear and explicitly stated, so I'm not activating it. And that is it for Klebsiella. And then we're going to move down to 54. And if you notice, there are 2 54s, and we need them both. So Maraxa catarrhalis, you want all of the cards there, so nice, easy one. And then Proteus, you want the first one, skip 2 and 3, but you want to grab 4, 5, and 6, skip 7 and 8, and then grab 9 and 10. And that is it for this video. Oh, wait, there's one thing. You made it to the end, and you didn't stop the video yet. Come back up here. So 35 Klebsiella. The very first card, or 2 cards, you'll notice that it said on your end, it'll say Klebsiella, Enterobacter, and Serratia are all lactose fermenters. That is wrong. Dr. His name's blanking today. What's her? Dr. Steinhauer mentioned today that Serratia are not considered lactose fermenters, despite what Sketchy thinks. They are very slow, if at all, lactose fermenters, so she is not going to consider them lactose fermenters. So I recommend changing this card for you. So Klebsiella, section 35, first two here, to say Klebsiella, Enterobacter, and not Serratia are all lactose fermenters. So just Klebsiella, Enterobacter, not Serratia. So that is it for this video. I hope this helps. Again, recommend Sketchy. So however you get that, or if you study with someone who has it, highly recommend. So that is it for this video. Happy studying.